Good evening, folks, or afternoon, folks. This afternoon's topic is about caregivers working amongst the shutdown and how it's affecting them as caregivers. So, with that being said, give me a couple seconds and we will get going on discussion C for the afternoon, evening. So, here we go. Let me get set, please. Give me a couple seconds. I'll grab my notes here. Give me a couple seconds to set up my notes so I can start to show for you. Give me a minute, guys, to get comfortable, and I'll be right with you, please. Here we go. Caregivers strain under Medicare changes. The phrase caregiver strain under Medicare changes encapsulates a growing crisis in the U.S. healthcare landscape, where both unpaid family caregivers and paid home health aides are being overwhelmed by shifting Medicare policies. These changes rooted in cost containment efforts ensure recruiting, restructuring, and evolving federal guidelines are creating cascading burdens that ripple through household, households, care teams, and communities. What's changing in Medicare and why it matters. Recent and upcoming Medicare policy shifts are reshaping how older adults and people with disabilities access care. These include expanded prior authorization requirements. More services now require pre approval, including physical therapy, durable medical equipment, and home health visits. This adds layers of bureaucracy and delays in care delivery. Cuts to home health funding. Proposed restrictions in Medicare reimbursement for home health agencies. Mean fewer visits, shorter durations, and tighter eligibility, uh, especially for rural and marginalized communities. Medicare Advantage Plan uh, contractions. Major insurers are exiting markets or trimming benefits for 2026, leaving beneficiaries scrambling to find new plans. This often results in narrower provider networks and higher out-of-pocket costs. Shift toward digital and remote care models. While telehealth expansion has benefits, it can exclude older adults with limited tech access or cognitive impairments, placing more pressure on caregivers to bridge the gap. How these changes impact caregivers. Caregivers, whether family members or paid aides, are absorbing the fallout in multiple ways. Administrative overload. Navigating prior authorizations, appeals, and shifting plan rules, consumer hours. Each week, caregivers must become the uh, the factor the factor case managers, often without training or compensation. Delayed or denied services. When approvals lag or are denied, care recipients miss therapies, equipment, or home visits. This can lead to preventable hospitalizations or worsening conditions. Financial strain. With plans cutting benefits or exiting markets, caregivers often pay out of pocket. for services that were previously covered. This includes transportation, respite care, and medical supplies. Workforce shortages. Home health agencies facing funding cuts may reduce staff or limit services. This pushes more hands on care, bathing, feeding, medication management onto family members, emotional burnout. The cumulative stress of juggling medical needs, ensure bureaucracy, and financial uncertainty leads to high rates of anxiety, depression, and caregiver fatigue. Real world examples from the page. The surrounding page content highlights vivid human centered consequences. A daughter in Pennsylvania who reduced her work hours to care for her mother after their home health care aides visits were cut from 3 times a week to once. A retired couple struggling to get approval for a wheelchair ramp, delaying discharge from rehab. A caregiver who spent 12 hours on the phone over 2 weeks trying to resolve a denied claim for in-home physical therapy. These stories underscore how policy changes through abstract on paper translate into real disruptions in daily life. Practical implications for families and advocates. For those supporting older adults, these shift demand proactive strategies. Track authorization timelines, keep detailed records of medical necessity, and follow up persistently on pending approvals. Review plan changes during open enrollment. Scrutinize provider networks, benefit structures, and out-of-pocket costs. Consider switching plans if coverage is reduced. Build a support network. Connect with local aging services, caregiver coalitions, and advocacy groups to share resources and navigate challenges. Document everything. Appeals often hinge on thorough documentation. Save emails, letters, and notes from provider visits. Advocate for policy reform. Join campaigns to push for streamlined authorization processes. expanded home health funding, and caregiver support programs. Broader context, why this matters systematically. These caregiver strains reflect deeper tensions in the U.S. healthcare system, a growing aging population with complex needs, a fragmented insurance landscape that shifts costs onto families, underinvestment in home and community based services, limited recognition and compensation for unpaid caregiving, labor disproportionately uh, shouldered by women and communities of color. Addressing these challenges requires not just policy tweaks, but a reimagining of how care is valued, funded, and delivered. Would you like help mapping out a toolkit or advocacy strategy to support caregiving or caregivers navigating these challenges? I'd be honored to co-create something with you. Okay, folks, so that is it for now. Uh, I will try and jump back on later for D. Until then, Gator Wellness. Take care, folks.